I'm Cherie Pilot.
I'm Nicole Eckerin.
I'm Rachel Hager.
I'm Troy Hager.
My name's Piper Hager. Imagine living in a world where everything you do is on repeat. You wake up and do seemingly normal activities, like getting dressed, going to the bathroom, and washing your hands. But then you wash your hands again, and again, until your hands are raw from constant scrubbing. This is what it can be like to live life as a person with OCD. OCD is also known as Obsessive Compulsive disorder, and according to BeyondOCD.org, it affects around 1 to 2% of the American population. Even with such a small percentage, that adds up to a lot of people. This means around 6,502,919 people are affected in America. Unfortunately, this seemingly small percentage affects my family today. Rachel, my twin sister, has OCD, and it has impacted both our lives since the 5th grade, when her symptoms started to develop. OCD, when severe enough, can take over a person's life. Rachel experiences obsessions and compulsions every day, which consume time in her life and mine. Because this has been a big part of my life, I have done research and experienced some of the things I'm going to talk with you about today. Obsessive compulsive disorder can be very confusing for the people who have it and the people around them. Today I will be sharing with you what OCD is, the symptoms that come with it, how the illness affects a person, and the treatment options available. To understand this disorder, a person must first know what OCD is and the symptoms that come with it. Obsessive compulsive disorder is a mental illness which causes anxiety in patients. And this anxiety is triggered by obsessions, which are usually unreasonable thoughts or fears. Obsessions cause compulsions, which are repetitive behaviors that they do to reduce the person's anxiety. Mayo Clinic staff said in their article, Obsessive Compulsive Disorder, Symptoms and Causes, that OCD obsessions are repeated, persistent, and unwanted thoughts, urges, or images that are intrusive and cause distress or anxiety. A few examples of obsessions a person might have is being afraid of contamination or being dirty, needing things orderly, or having a fear that they are unsafe or they cause harm to themselves or others. Information found from the same article says that compulsions are repetitive behaviors that a person feels driven to perform, and this is meant to reduce the anxiety. Compulsions may include washing themselves or objects, counting and checking, having patterns, or making sure things are neat and orderly. Because these symptoms occur frequently during daily life and can be quite severe, obsessive compulsive disorder can be very influential on a person. BeyondOCD.org mentioned that OCD is a disabling disorder, and it has been ranked in the top 10 of the most disabling illnesses of any kind. OCD can be considered so traumatizing as it can affect several aspects of the life. Obsessive compulsive disorder can affect the daily life of a person, and according to the Cyclopedia team, OCD can cause people to spend several hours a day focusing on obsessions and compulsions, and this contributes to their high levels of anxiety. They also said that employment can be impacted. Because people spend so much time on their symptoms, it can result in a diminishing of their work ability, and that results in lost earnings. Information found on beyondocd.org says that social relationships with parents, siblings, friends, and family can be negatively impacted. The severity of OCD can be so high that it impacts other people other than the patients. Those around the patients may also struggle to keep up with their loved one's symptoms, and this causes tension within relationships. These symptoms also make it difficult to leave the house on some days, and that can affect a person's education. When at school, a person may be focusing on the intrusive thoughts they have, and this makes it hard to focus on learning, doing homework, or getting good grades. Schools may also be considered dirty to people who have contamination issues, and this makes it difficult to learn because they're in an environment that causes a high amount of anxiety. Symptoms can be mild to severe, and it takes a toll on a patient with OCD, but luckily there's hope because of the treatment options starting to become available. Because of the awareness of OCD is rising, more treatment options are becoming available for those who suffer with this disorder. Therapy is one of the most common ways to treat OCD, but there are several types of therapy to choose from when starting to treat your illness. Information found from the article Obsessive Compulsive Disorder Diagnosis and Treatment from MayoClinic.org mentions that cognitive behavioral therapy, CBT, and exposure response prevention therapy, ERP or ERP, can help bring symptoms of OCD under control. CBT is effective for several people with OCD, and it's used quite often. ERP is a type of therapy that gradually exposes a person to what they fear. This teaches them new ways to cope with their anxiety so they will do compulsions less and less often. A briefer version of CBT and ERP is known as quick therapy. Claudia Wallace, author of the article Psychotherapy in a Flash, says that testing has been done for quick therapy, and it's getting results similar to those of slower versions. The main goal of this type of therapy is to get the patient treated quickly and effectively, so their relief is accelerated. If these therapies aren't enough, people can also take medication. According to the article Obsessive Compulsive Disorder Diagnosis and Treatment, written by the Mayo Clinic staff, medication can also be used to assist with therapy when treating OCD. Typically, medication is used when the symptom or person experiences is too severe for therapy to fix all on its own. Psychiatric medications are used most often when treating OCD, and some examples of this medication from the Mayo Clinic staff include sertraline, Prozac, and anafranil. Today I shared with you the complexity of obsessive-compulsive disorder and the wide range of symptoms it has on people, and the treatments to help reduce symptoms and anxieties. Although the percentage of people with OCD is small, the amount of people affected is shockingly ginormous, with over 6 million having the illness. The severity of OCD can range from severe to mild, and sometimes you may not even know a person has it. From my experience with my twin sister, I've learned about an illness which can consume a person's life, and it makes it hard to live day to day. And having this information to be tolerant of those with the illness really helps them out. Obsessive-compulsive disorder may not affect you personally, but the symptoms, ways it affects people, and the treatments available that I've shared with you today may give you a better awareness of this illness, which has a huge impact on millions of lives today.
Nicole Eckerin.
Rachel Hager.
Cherie Pyland.
Troy Hager.